In our final segment, I'll speak with Dr. Bonati, founder and chief orthopedic surgeon of the Bonati Spine Institute. Dr. Bonati is passionate about healing his patients, not providing a temporary fix or treating only a symptom that requires them to leave and still be on pain medications. Now, nearly half the Institute's patients come to them after having failed back and neck surgeries at other facilities. And it's an alarming rate, which troubles Dr. Bonati, that invasive, archaic methods are still being performed when the Bonati spine procedures should be considered first. There are many other so-called minimally invasive procedures out there, none of which compare to the exclusive patented Bonati spine procedures. So we know at the Bonati Spine Institute that nearly half your patients have suffered previously with failed neck and back surgeries elsewhere before finding you in the Bonati Spine Institute. How does that make you feel?
I think we prove with the results that we have at the Institute and the result that all the physicians at the Institute can accomplish, that we are probably the best. If anybody tried to challenge what I said, I like to compare results.
Right.
And I like to show them what we do and see if they can do what we do.
Right.
So, leaving my ego on the back door, I am extremely happy that we can offer with the Bonati Institute program results on the 98.7%.
Right. It's not you saying, well, hey, I performed that surgery and therefore success.
Yeah.
It is true patient resolve where through the Bonati Spine Institute, you're helping people regain their strength and get back in motion. And that's why we like to say Bonati succeeds where others fail. Now, I know you said you feel great because then you're able to prove how well your patented and exclusive Bonati spine procedures work. But on the other side, doesn't it make you a little bit sad to know that this is the reality of our medical system, that half of the patients that come to you have already suffered through either an unneeded surgery or something so invasive where they're putting screws and plates into people that don't need to be there? What do you think about screws and plates being called minimally invasive? To me, it sounds ironic.
Well, when you talk about the minimally invasive procedure that they are talking about, fusions, that is a disaster. It's a disaster because they are prostituting the minimally invasive fields with procedures that they are already proven that they are a failed procedure, that is a fusion, the open fusion.
Correct.
So you're changing the open fusion for the minimally invasive fusion. What really you are creating is you are creating more problems without really seeing the pathology of the individual. So because of that, I am totally against fusions.
Right.
I did open surgery in my life before. I did fusions in my life before. I did the scoliosis and I fused backs before. But every time when I left that operating room, I was more depressed than you can imagine because I knew that I didn't help that person. And even if I do a procedure that was anatomically correct and that was perfect from the point of surgical procedure, was a disaster for the patient. When you talk about fusions, around 40% of the fusions, they get somehow better. 60% of the fusions, they don't work. Every single day, you have procedures performed with fusions. And the amount of fusions that you do in the country are enormous. But they are being supported by companies that they also make a lot of money, and hospitals that they make a lot of money with all these gadgets and all these things that they really know that they don't work.
And I think a lot of the success that you receive is because the patient is somewhat awake, aware, and alert. That's the conscious IV sedation, and they're in constant communication with you and the other surgeons during their surgery. And that really helps you pinpoint, target the true root cause of the problem.
But the real truth is, you're right. With general anesthesia, we will not be able to be so accurate. with these conscious IV sedation. The patient is our partner, and the patient pinpoint for us where the problems are.
Right.
And then we look pretty good, but it's because they are helping us.
Well, they are, and even on the table, we've heard it with the radio show and even the TV program, how you ask them to get up and try to recreate their pain, and some actually end up crying on the table, saying it's for the first time in years they don't have that pain. Thank you for watching American Medicine Today. Remember, you do not have to live with back pain. There is an option. Find out if the world-renowned Bonati Spine Procedures can help you. If you have any comments or questions, contact us at the number below. You can also tweet at Dr. Bonati using hashtag American Medicine Today or hashtag AMT. We respect your views and opinions and would like to hear from you.